Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, according to new physical fitness guidelines, which were recently issued and released by the federal government, less than 1/3 of Americans and only 1 in 5 teenagers are getting the recommended amount of exercise each week. That's not surprising, I guess.
Not really, no. The guidelines recommend the same level or amount of exercise as the original standards that were released in 2008, but don't require the physical activity to occur in at least 10-minute blocks. The message is, I'm going to break it down for you. Every little bit helps. Here to discuss is Mayo Clinic anesthesiologist and human performance expert, Dr. Michael Joyner. Welcome back to the program, Dr. Joyner. It's great to see you again.
Good to see you, Tracy. Good to see you, Tom.
Dr. Joyner, always good to have you on the program. And we want to ask you about it seems like they're changing guidelines for everything all of the time, whether it's blood pressure or mammograms or PSA, and now they've changed the exercise guidelines. Why?
I'd say it's more of a subtle shift or just a minor modification, as Tracy indicated. The basic idea of still trying to get 150 minutes a week of moderately vigorous physical activity, they're still right there, or 75 minutes a week of more vigorous physical activity. But the idea is now you can take it in small bites and just to do something, and they really want to focus on what used to be called sort of incidental physical activity. Take a couple of flights of stairs, walk in from the parking lot, that sort of thing. And just to do something and avoid prolonged sitting time.
Usually, when I see these recommendations, the one that's for adults is 150 minutes a week. So break it down if you want to do 5 minutes or 50 minutes, whatever. But I never have noticed, maybe I've just not been paying attention, that it also says 2 sessions of muscle strengthening.
Right.
Is that additional, or have I just not?
That's been around for a while as well. Because one of the things that's happened, especially as people get older, is they lose muscle mass and become frail. And of course, you see this in many of your patients, Tom, and that leads to falls and other things as people get older. And aerobic capacity, or the ability to walk or go upstairs, it doesn't really rate limit what a lot of older people can do. It's getting out of the car, opening the can on something, doing something that requires some sort of strength. And the data shows that about 70% of 70-year-olds can't get off the floor because they're so weak.
Yeah, amazing, isn't it? So what counts as, when you talk about muscle strengthening, and I notice there are guidelines for children, too, between the ages of 6 and 17, what is muscle strengthening? What counts as muscle strengthening?
Oh, it could range from anything going to the gym and weightlifting to just doing body weight exercises and calisthenics at home. Things as simple as push-ups, and even people who can't do a regular push-up can push against the wall. There's things people can do in chairs, things like static wall sit that the skiers use when they sit up against the wall. Many, many things that people could do. The big, huge rubber bands, the stretch bands can be very, very effective and are things you can take with you.
Those rubber bands.
What about you and our producer, Jen?
Yeah.
I know that you're over there buffing it up.
We're actually going to go lift after we're done here today. Yeah, a couple
real
of
weights,
times.
iron, you're pumping iron.
Yes, dumbbells, and and twice a week is what we're doing. But one of the things I notice is that for children age 6 to 17, 3 strengthening sessions per week.
Yeah, I think the children need to do more, and I think to the extent possible, 60 minutes a week or 60 minutes a day of moderately vigorous or vigorous physical activity, which is a problem for the kids who aren't playing sports because there's so little physical education in schools these days compared to when we were kids, kind of in the golden era. But yeah, well, we all got exposed to President Kennedy's plan, the fitness program, because people were concerned about military preparedness and what would happen if there was a shooting war during the Cold War, and that's only gotten worse. And so I think that's really one of the big problems too. And I think one of the goals with kids is to try to generate some muscle mass and keep people from getting fat when they're younger. It becomes harder to gain weight as you get older. So if people are lean through their teen years, that's a good thing.
We got a lot of exercise just practicing duck and cover. Remember that?
Right, yeah,
During
exactly.
the Cold War?
Right, exactly.
I mean, we could have been attacked any minute.
Yeah.
Fortunately, we weren't. But muscle strengthening, is it true that we lose 1 to 2% of our muscle mass every year after age 30? I've heard that said.
30 or 40. What's really interesting, though, is that with strength training time, you can delay that by about 10 years. And you can reduce the rate of loss to almost nothing. Now, when people get to be 60 or 70, there is going to be some obligatory loss. And certainly when people get into their middle 80s, almost everybody starts to lose muscle mass. But again, you've seen it in some of your patients who've retained their muscle mass, and it's almost like they're a different species of humans.
If you do it twice a week, a pretty good likelihood that
Yes.
you can maintain your muscle mass.
Absolutely, absolutely. And again, in the old days, we used to push mowers that were non-mechanized, where people used to go out and do all sorts of things, garden, farm, and just do regular lifting all the time. But we've made it so easy to live such a convenient life that people aren't getting the strengthening exercises that they need.
And what counts as aerobic activity?
Well, aerobic activity, typically you think about something that is sustained, uses a large mass of muscle, so walking, swimming, running, riding a bike, things like that. And it's something that requires mostly oxygen, so you're not going in any type of oxygen debt or oxygen deficit. So it's something you can sustain for a long period of time. Now, how hard it is depends on your perception of effort, your heart rate, and things like that.
So, though, even if you're just doing 5 minutes of exercise,
Right.
cardiovascular-wise, that doesn't seem to make sense that it still counts.
Well, it's really interesting. If you start looking at the dose-response curves of physical activity versus mortality, you start to see benefits with 5 or 10 minutes per day. Things start to flatten out after about 30 minutes a day. So when people are doing, like I do, an hour a day, they're doing it for other reasons.
What about sitting? There's been a lot of information
Right.
out there, and one of the things that someone has said or I've read is that sitting at a desk all day is as bad for you as smoking. You read that?
No, that's an over statement or an over extrapolation. Sitting all day long can obviate some of the benefits of exercise, especially in people with ongoing risk factors, diabetes, hypertension, people who've got other problems. It's especially troublesome for those individuals. But for individuals who are otherwise healthy, sitting 6-8 hours a day is no fun, but it's if they're physically active the rest of the day, it's not a huge problem.
So why is it that they would change for these guidelines, the exercise guidelines,
Right.
that it doesn't have to be 10 minutes?
Well, I think new evidence shows in not so much randomized studies, but observational evidence in large populations shows that people who just literally get more incidental physical activity in small bites get some benefit from it. And I think that we have so many people that have so many barriers to physical activity and exercise that they didn't want people to think, well, if I have to do this dose, this duration, this many days per week, when in fact do something was probably a more important message.
Are you a fan of the stand-up desk and the treadmill desk?
I'm not a fan or a non-fan. I think people have to find something that works for them. The people I know who like stand-up desk are people that have back problems or other things going on. The people in terms of the walking desk, people can do their email and do simple tasks, but people have found it more difficult to do complicated things on those, and there aren't that many of them.
So the problem, whether it's a desk at work or if you have to go to the store and you decide
Right.
to drive instead of walk 3 blocks, it's the activity versus the inactivity.
Right.
How do we build more activity?
Right, and there's a lot of thought going on to things like urban design and how we make communities more walking friendly. There's some terrific data from Toronto where they've looked at population weight gain over the last 20 years and compared it to the walkability of the neighborhoods. And in neighborhoods with high walkability, there hasn't been nearly so much weight gain as in neighborhoods with low walkability. Simple things like that. There are tremendous experiments of nature in places like Amsterdam and Copenhagen, where about half the people ride their bikes to work, and those people get almost no age-related weight gain. And those are rich societies with plenty of food around there, where the people who use motorized transport typically gain a bit more weight.
So before we finish up this segment, I know that in addition to being an anesthesiologist, you're also a human performance expert. You run a lab. What's the most exciting thing you're doing in your lab right now?
Well, believe it or not, Tom, we're interested in how hemoglobin, that's the stuff in your blood that keeps it
Carries
red,
oxygen.
carries
Yep.
oxygen. We have some unusual patients with hemoglobin that grabs extra oxygen, and we're studying their responses to exercise.
Like those are the elite athletes, maybe?
No,
Some of them? Or?
they're not elite athletes. They're just people that have hemoglobin that grabs extra oxygen, and they've been called human llamas, which is what, believe it
I
or
was
not.
going to ask, are these the human llamas I've
yeah,
heard about?
Yeah, so what happens is in some of the animals that are adapted to live at 10 or 15,000 feet, they have hemoglobin that grabs extra oxygen. And at least our preliminary data shows that these individuals, when we make them hypoxic, we give them 15% instead of 21% oxygen, which is like going to 10,000 feet. They're remarkably resistant to hypoxia. Their heart rate hardly rises at all. So it's been very fascinating.
All right, good for you. Always something exciting going on in your lab.
There sure is.
All right, we're talking with Dr. Michael Joyner. He's an anesthesiologist and a human performance expert. We've been talking about the new federal guidelines for exercise. Time for a short break.
When we come back, what was once thought of as being out of reach is now almost a reality. The sub 2-hour marathon.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are back talking with human performance expert and anesthesiologist, Dr. Michael Joyner. Dr. Joyner is an expert on elite athletic performance, like you, Jen, now.
Exactly.
And he suggested way back in 1991 that the ideal athlete, under the ideal right circumstances, could run a marathon in less than 2 hours.
That's a long... Yeah, that is a 26. Yeah.
How many miles is that?
Dr. Joyner, how close are we to a human being being able to run over 26 miles in under 2 hours?
Well, Eliud Kipchoge, the great Kenyan runner, ran 2:01:39 at Berlin earlier this fall. Oh. And about a year and a half ago, in a special sort of setup race that Nike organized, he ran 2 hours and 25 seconds. Now, that was kind of paced and contrived, and there were some other things done to make sure he could go as fast as possible. So we're getting closer. When I wrote the article back in the early 90s, the world record was just under 2:07.
And what allows someone to be able to do that?
Well, there are three factors, Tom, that can be likened to what's in a car. One is something called maximal oxygen uptake, and you can think of that as engine size. So that's how much oxygen somebody can get out of the air into their lungs. Their lungs can deliver to their blood. The blood is pumped by the heart, and then it's used the oxygen's then used in the skeletal muscle. So the average person can use around 3 liters a minute. Elite athletes can use 5, 6, sometimes 7 liters a minute. So double what's normal. Now, in Kipchoge's case, he's also very small. Weighs probably 55 or 60 kilos, so 125, 130 pounds. So that's like putting, a very, very large V12 engine in a very small car. Now, the next thing you can think about is like in a sports car, the red line. So he can use about 85, 90% of his maximal oxygen uptake for hours. The average person can only use around 50 or 60%. And that's because his muscles have adapted to years and years of training. And he has extra blood vessels in his muscles, and little things called mitochondria that burn the oxygen are increased as well. And then the other thing is he's super efficient. So not only has he got a big engine and kind of a high red line, he gets good gas mileage.
Is he going to be, though, the only person who does that? I mean, when you break these, we'll never get past the 4-minute mile and these different things like that, then pretty soon everybody is doing that. Do you think that we're going to get to a time where, not everybody, I won't get there.
Marathons are tough because the conditions have to be just right, and the top guys can only run 1 or 2 races per year at the highest level, where the top milers can run 5 or 10 really superior efforts every year. So these guys only have maybe 10 or 15 shots to a year for 6 or 8 years at the elite level to do this. They also are interested in competing in the Olympics. The Olympics are typically it's in the summer. The conditions aren't that good. So I don't think it'll ever become super commonplace, but I think that there are plenty of people, certainly with the engine size and the lactate threshold of Kipchoge, and probably with the efficiency of Kipchoge. But he also is extremely gifted mentally. He's able to stay relaxed while he's suffering and trains very, very hard, around 120 miles a week at 8,000 feet.
I want to ask you, I have a daughter who is a graduate student in California, and she's been doing some triathlons. Right. And we have watched her a couple of times at a national meet down in Tuscaloosa, Alabama. And the one thing that becomes clear every year is that the Colorado teams, the ones who train at high altitude, seem to have a leg up and seem to win every year.
Well, altitude training is certainly something that's emerged since 1968. In 1968, Tom, the Olympics were in Mexico City, which was 7,000 feet, and athletes from Kenya and Ethiopia did very well, and the athletes from other countries who trained in places like Flagstaff, Arizona, did very well as well. So altitude training is something that the elites sometimes use to try to get an extra edge. It's especially good if people are training at high altitude. But the other thing about a place like Boulder and the University of Colorado is it's become really a magnet for all the top people. And so there are large numbers of elite athletes who've moved to Boulder. So you don't know whether it's the altitude per se and training at high altitude, or just also that they've developed a culture and environment in Boulder that facilitates this.
Aside from the fact that we annoy them at races and they leave us in the dust, what is the difference between these elite athletes and weekend runners and like myself?
Well, a couple things. One is that they have these very high VO2 max values. And now everybody can increase their VO2 max value.
That's explained to us
the
again.
maximal oxygen uptake.
Okay.
That's the ability to get
how much oxygen you can get out of the regular air.
The regular air to your muscles. So you got to have big lungs, big heart, good blood vessels to do that. So most people are four-cylinder engines, and a few people are naturally six-cylinder engines. And most people can increase, pretty dramatically, but only a few people can become 12-cylinder engines. Nobody knows exactly why. They haven't been able to find a genetic signature that explains this, but just some people can do it, others can't. So that's one thing that really sets them apart. And then once you have that very, very high maximal oxygen uptake, then years of training permit you to develop a very high lactate threshold and might improve your efficiency. But there are people who have, really good lactate thresholds, really high VO2 maxes, but are very inefficient, and they run a 2:30 marathon. They can only run a 2:30 marathon.
So for our listeners who may not know, explain to us why high altitude training might be helpful in running a marathon.
The main thing is that the chronic hypoxia would stimulate the release of more red blood cells, or the formation of more red blood cells.
Hypoxia means lack of oxygen.
Lack of oxygen.
Because of the high altitude.
Altitude will cause something called erythropoietin to be secreted by the kidney. This is similar to what EPO, which is the drug that people like Lance Armstrong were busted for, and increase the total number of red cells in your body. The
red cells carry the oxygen, and the more oxygen you can get to your muscle, the faster and the farther you can run.
And now the other thing that happens, if you look at people who've spent their whole life at high altitude, who were born there, like these Kenyans and Ethiopians, like some of the Native Americans in the Southwest, and also just regular, people from every racial or ethnic group who grow up at high altitude, their lungs get bigger. So the surface area of their lungs are bigger, and something called your diffusing capacity is higher. But that only happens if you were born there during growth and development. So if you move to altitude at age 20, that won't help you so much.
So just to put this whole thing in perspective, and I don't want to embarrass anyone here, but let's say, do you run marathons, right? Or half
I run
marathon?
half marathons.
Okay, so that would be, 13 miles?
Yes.
And
in just under 3 hours. 2 hours and 45
so that
minutes.
would translate into 6 or 7 hours for 26 miles. And there's a guy out there he runs a little faster than you
just
do.
Just a bit.
Like
and you can hear him coming during the race. You got to get out of their way.
So you think this will happen? I mean, I guess we're 25 seconds away?
Yeah, well, it depends on how you count. Either 1:39 in a sanction race or 25 seconds in this exhibition. I think it could happen anytime, provided somebody did exactly what Nike did in 2017. One, get a flat, fast course, limit the number of right angle turns, run it at an optimal time of the year when it's cool, and set up a pacing strategy which permitted as many people as possible to participate and kind of drag somebody, 20, 22, 23 miles in at a very fast pace.
And you predicted this would happen in 1991?
Yeah, I wouldn't call it a prediction in 1991. In 1991, I was just trying to look at these limiting factors I discussed and see how the puzzle might fit together, and say, wow, somebody can break 2 hours. The world record's about 2:07. What don't we know? I was trying to understand what we didn't know, Tom, but this has morphed into a prediction as they've gotten closer.
All right, we've been talking about all things exercise and elite athletic performance with Mayo Clinic anesthesiologist and human performance expert, Dr. Michael Joyner. Dr. Joyner, always great to have you in the program. Thanks for being here.
Great to be here.